Okay, that familiar sound, meaning that it's time for our In Focus Health segment, and we're joined by none other than our health correspondent, Lino Madu. Hi, Lenore.
Hello, Jimiaki.
Now, today you're going to focus on HIV and AIDS.
Absolutely. And we start in Africa, sub-Saharan Africa, of course, a clinical trial aimed at investigating whether an antiretroviral pill taken once a day could prevent women from getting HIV has been abandoned. Almost 2,000 HIV-negative women, including 1,200 South Africans, participated in the study. It aimed to see whether Truvada, a combination pill of tenofovir and FTC, could help protect high-risk women from HIV. The trial was halted following a review of results found no progress or conclusive results. Namibia is encouraging its men to be more actively involved in health issues concerning their HIV-infected partners. The government and UNICEF say men need to play a larger role in the HIV/AIDS treatment process of their partners and give them the support they need. They say this contribution will help greatly as the nation moves toward eliminating mother-to-child transmission of HIV by 2015. Israel Ndeshania, wife Elizabeth, is HIV positive, but their 8-month-old baby is HIV negative. Here he is.
Since she found out her status, I've never been unkind to her or pointed a finger at her. We live as peacefully as we did before. If you think I'm lying, you can ask her.
And the government of Namibia is helping HIV-positive mothers deliver healthy babies. They say that it is important for them to protect their children with breastfeeding.
The rapid advice that was released by the World Health Organization and UNICEF a year and a half ago is now promoting exclusive breastfeeding for women who are HIV positive and for them or their infants to take antiretroviral prophylaxis at the same time. This means that there can be no doubt now that for all women, even HIV positive women, that breast is best for themselves and for their newborn infant.
In Burundi, more than 300 AIDS activists recently demonstrated in the streets of Bujumbura to protest what they say is the government's lack of action in dealing with HIV/AIDS. The activists lay down in front of the Ministry of Health and HIV/AIDS prevention offices as a symbolic gesture to protest what they perceive is a lack of activity on the part of the government and to address the shortages of antiretroviral drugs. They are accusing the government of mismanaging funds that they were allocated to provide ARVs for more than 60% of HIV-positive people who depend on the drugs. Jane Gapia has been living with the disease for more than a decade.
If nothing is done, we will die. And it's exactly what's going to happen. We will die. But there are people who are already dead in the last 3 months. And I think that is unacceptable in a country that has a government and that has people that have been elected for that. It's a fundamental right, and we demand that a solution must be found immediately.
173,000 of Burundi's 8 million people are affected by HIV and AIDS, and only 22,000 of those people are receiving proper treatment. The Burundian government is currently providing about $1 million through the World Bank towards HIV/AIDS. Another $8 million is being raised by various AIDS associations. Victor Nsabimana is protesting to support those living with the condition.
What I came here to say is that they are orphans and they are people like others. They are children who will grow up and who will contribute to this country. If nothing is done, they will die tomorrow. I don't think it would be a good thing for our families and even for this country, because they are the future of this nation.
Burundi's government says it has not received enough funds from donors this year. Officials at the Ministry of Health say it is always working in collaboration with NGOs to fight the spread of the HIV/AIDS pandemic and help those affected by it. Dr. Fulgence Birikania is the Chief of Staff at Burundi's Ministry of Health.
We always say that the doors are always open here at the Health Ministry in order to exchange ideas. And the other question concerning our people, we hope that our partners in the civil society will contribute to use this path of dialogue in a constructive manner and in the interest of those who are HIV positive, without necessarily having to take to the streets.
And that's all for today, Dimiaki.
Well, you know, I have to say how we're always talking about how sometimes HIV and AIDS is always restricted to World AIDS Day, but it's so important that you bring it to the fore today, as the women in Bujumbura did.
Absolutely. It's very important because sometimes we tend to forget that this is an issue that is there, and it's not just, like you said, it's not just a World AIDS Day issue, and people have to really tackle HIV/AIDS, especially when it comes to prevention. I think that we really need to scale up the prevention message, and health ministries, governments in Sub-Saharan Africa have to really scale up that message.
I think you're helping them do just that.
We hope so.
Of course. Lino Madu joins us every Tuesday and Thursdays here on In Focus, always has the latest health news.